Mrs. Fair, my name's Megan. I'm going to be your student nurse today. Is it okay if I do an abdominal assessment on you? Okay, perfect. So starting out, I just want to ask you a couple questions. Have you ever had surgery on your abdominal area? And have you ever had any pain recently with it? No? Okay, awesome. So starting out, I'm just going to check the movements of her abdomen. I'm checking for respirations, pulsations, and peristaltic waves. So I'm going to get eye level to check those. So I do see respirations, and I also see light pulsation, but I do not see peristaltic waves. Now moving on to the contour of her abdomen. The shape is a nice rounded, yet flat shape, and it is symmetrical as well. And then looking at the skin comparison to the rest of the body, it is even throughout her abdomen, and I see no abnormalities present. And then looking at her umbilicus, it is midline, introverted, and there's no lesions present, such as piercings or anything of that sort. And now moving on from that, I'm going to check the muscles within her abdomen. So I'm checking for herniation within her rectus, femoral, and inguinal area. So I'm going to ask my client to slightly raise her head so her chin barely touches her chest, and I'm looking for that herniation throughout the muscles. So slightly lift your head. Okay, so I see no herniation present within those three areas. And now moving on, I'm going to go to auscultation for her bowel sounds, and I'm going to start in the right lower quadrant and just listen and use a zigzag formation with that. Okay, so in listening for bowel sounds, I heard even bowel sounds throughout all four quadrants, and they were high pitched. The frequency could be anywhere from 5 to 30 per minute, and I didn't hear any abnormalities or anything of that sort. So moving on, I'm going to check the Barrett's. So I'm going in the aortic, renal, iliac, and femoral areas. I'm going to use that exact same zigzag pattern for this as well. Starting in the femoral. Iliac, renal, and aortic. Okay, so I didn't hear any bruits within the stomach. They're a little bit harder to hear. And I didn't hear any abnormalities. If I did, I would listen in each quadrant for anywhere from 5 to 10 minutes to help rule that out. And now I'm going to go to percussion. So I'm going to use that exact same zigzag to just get a general note of everything. Let me know if you have any pain when I do this. Okay, so the general percussion is it's pretty even sound all the way across. We do have a lot of organs, so I wouldn't necessarily expect anything different. And then I didn't hear any abnormalities or anything of that sort, no tenderness from the patient as well. So moving on, I'm going to check the patient's liver span, and I'm going to get the mean diameter of this. So I have my ruler. So I'm just going to start, and I'm going to percuss down until I hear dullness, and then I'm going to mark that, and then I'm going to do the exact opposite on the way up so I can get that diameter of high and low of the liver span. Okay, so I'd mark right there because I hear dullness. So I'm going to mark that, and then I'm going to do the same thing on the way up. And I hear dullness right there. So looking at that measurement, I would get my ruler out, and I would measure it to be 6 centimeters, which is in the normal range. So moving on from that, I'm going to percuss the spleen, which is on her left side. So progressing from that, spleen sounds normal. It's a nice heavy resonance. I didn't feel any abnormalities with that either. And then gastric air bubble, I'm just going to percuss on the stomach and see if I can get an air bubble. Alright, so I didn't have an air bubble within the stomach. And now moving on to palpation, I'm going to check for herniation in the ubiculus. So I would put on gloves at this point. And I'm just going to feel around the belly button by slightly pinching. I didn't feel any herniation, which is good. And now moving on, I'm going to do light palpation in the same zigzag. I'm just going to use my 2 fingers with the pads of it. I'm checking for tenderness, and I'm also checking for masses within the abdomen. So I'm just doing a circular motion in that zigzag formation. Just lightly pressing. Okay, so I didn't feel any masses, and the patient didn't have any tenderness, so everything checks out there. And now I'm going to go into deep palpation. So I'm going to do the exact same zigzag throughout, and then I'm going to check for tenderness and masses as well. I'm going to use 2 hands. I'm just lightly dipping, not lightly, but just dipping in. Okay, so I didn't feel any masses with deep palpation, and the patient didn't have any tenderness there. So moving on, I'm going to check the right and left kidney, the spleen, and the liver of a deep palpation. This, I'm going to use a duckbill, and I'm going to ask my client to slightly raise on each side once I get to that side, so I can get a nice palpation. So if you will, Miss Barrett, each time I go to palpate, if you will take a deep breath, I will tell you when. So this, I'm checking for the left kidney, so I'm using this duckbill. If you will turn over to your right slightly. Perfect. Okay, if you'll take a deep breath for me. Palpate. Okay, did you have any pain with that? No? Okay, good. So, left kidney's all good. I'm gonna stay on this side. And if you will just lift to your left for me. Same duckbill. Palpation. Did you breathe in for me? Did you have any pain with that? Awesome. Okay, so now I'm going to do the spleen, which is over here on the left side. Deep breath for me. Okay, now I'm going to do the liver. Deep breath for me. Okay, with that deep palpation, I could feel each organ, and it feels normal. I didn't have any lumps on it or anything of that sort. There was no abnormalities present. And I believe that is all for my assessment, so I would finish washing my hands. And thank you, Ms. Fair, for allowing me to do my assessment with you.